A runny, drippy nose can be a source of irritation for your dog, and that's exactly what I'm talking about today. What the causes of a nasal discharge are, kind of a bit of a snotty nose, what investigation can be done to try and get to the bottom of that, and how can we just get rid of this mucus, get rid of this runny nose in the first place. My next question today is from Amanda, who lives in Mauritius, and she's got a little griffin dog, and she's pretty sure that she has post-nasal drip. And it sounds like she's also got phlegm at the back of her throat. So what would I recommend to soften up this phlegm and to kind of get rid of this problem? This little dog is also prone to allergies, and the vet has prescribed an antihistamine, but Amanda's not a fan of all things chemical, and so she's tried adding turmeric and cocoa oil to her little dog's diet. She also notices that when she gives her a spoonful of honey, it seems to just help her to clear her throat, to do a little gag, and all seems to clear up. So can I give some advice to help in this case? Well, I'll first start by saying I could do with some honey. So I'm suffering from a bit of a cold at the moment, so apologies if I sound a little bit funny. But yeah, let's get into this dog's question and this dog's problem. So a chronic nasal discharge, it can be caused by a number of different problems, and I don't think most of these are going to be even a concern in this dog, but just to quickly run through them, we can get fungal disease. Now that's more common in long-nosed dog breeds and in tropical climates as well. That generally causes a snotty or bloody discharge, and it's normally from one side, at least initially. We can get foreign bodies, so something that's been snorted up into the nose, like a grass seed or a blade of grass or a bit of stick or something like that. Again, we tend to get a snotty, bloody discharge, again, that is one-sided from one nostril, unless multiple things have been snorted up, each side of the nose. Now we can get nasal tumours, so tumours in the nose, and actually if you, are interested in hearing more about that, then check out episode number 14 of this podcast for a full breakdown of nasal tumours in dogs. And then finally, we can get allergic and immune-mediated disease, causing kind of a chronic, long-term inflammation within the nose, causing something called chronic rhinitis. And chronic rhinitis is also known as post-nasal drip in humans. It's not a term that we tend to use in dogs, but yeah, that's kind of the human term, so for this chronic rhinitis. Now you notice that I didn't say infection there, and that's because infections in noses are generally not a primary problem, so they're not normally the main problem. We can get infections up noses, but they normally come because there's something else going on. So because there is a long-term inflammation because of an allergic disease, for example, or because there is a foreign body up there, or because there is a tumour, can then result in an infection which will respond to antibiotics, but they don't tend to be the first thing that we think about. And if a dog does have an infection and responds to antibiotics, we still need to be thinking, what is the underlying cause of that? So what can we do for diagnostics? How can we go about diagnosing what the causes of a nasal discharge are? Well, really, we're going to take a good history, what's going on, how long's it been going on for, has it fluctuated and changed in severity, did it come on very quickly, has it come on slowly, is it only a problem at certain times of year? We can do blood tests, we can take a swab of the nose, so stick a swab up the nose to have a look under the microscope and to see what grows in the laboratory. We could do x-rays, we can do CT scans, biopsies, so there's lots that we can do, and the nose can be a frustrating and difficult place to try and find out what the underlying problem is. Now we can also give a treatment trial, so that could be, for example, antibiotics and steroids if we think we've got an allergic disease or an immune mediated problem, and then monitor the response to that. And that's especially going to be appropriate if this is maybe the first time that that we're seeing the problem and it's not been there for a long time, or if it's very mild disease and there are no other concerns on examination. And really the best treatment is going to depend on the underlying cause, what's going on, so that we can tackle that. And you can tell from all of the potential different causes that the treatment for each is going to be very different. Now, I think allergies are going to be the most likely problem for Amanda's little griffin here. Given the history, given the presentation, the fact that there's general allergies and she's responded well to antihistamines in the past. So we'll start off the kind of what can we do to clear the mucus? Well, the first thing to clear any mucus that's going on in the nose, or if it's kind of going on down, if your dog's got a cough and they've got like a chronic bronchitis, then the same applies. We need to ensure that the dog is well hydrated. So that will just help make sure that the mucus is kind of nice and moist. It's not kind of really thick, and so it's more easy for the dog to kind of express it, to expel it, and to kind of shift it and move it on. So we can ensure hydration by feeding wet food, maybe by adding water to the diet, by putting ice cubes in the water, you know, maybe a little bit of flavour, a little bit of a stock cube or something like that. We want to avoid anything with a lot of salt, so low salt stock cube, or boiling up a little bit of chicken or vegetables or something like that, just to give it a bit of flavour. Refreshing the water regularly is important. Running water is another option. Some dogs will really enjoy drinking from running water, and that's where we can then use a pet fountain as well, just to help with that running water. So ensure that hydration. Next up, we think steam. So if we're all bunged up, then, you know, we feel better after we've had a kind of a hot steamy shower. If you put your head over a bowl of hot water, that steam will just help. Again, that really helps just get into the mucus, to help hydrate the mucus and allow it to kind of flow and be shifted much more easily by the body. So, you know, we can do this for our dogs by taking them into the bathroom while you are having a hot shower, so that they're in that steamy room. Now, there are also medications that we can give, certainly in the short term, to help shift the mucus. So something called bromhexine, you know, may be beneficial. We tend to think of that maybe more if we've got a really mucousy kind of airway. So if they've got a really mucousy cough, so like a chronic bronchitis rather than a nasal problem, but that might be something to think about. And then honey, you know, that may help soothe the throat irritation. It's something that many people will claim. You know, I suspect if it does have a benefit, it's fairly minor, but there's not really going to be any harm to giving that go. And if you feel it's beneficial, then, you know, sure, keep giving it. Now, as far as turmeric goes, well, curcumin is actually the active ingredient that is found in turmeric, and curcumin, it does have an anti-inflammatory effect. But, and there's a big but here, it's only found in very low levels in turmeric. So to get any potential benefit dose, you know, beneficial effect of the curcumin, you'd have to feed an awful lot of turmeric. So, you know, that's something to consider. And I think just a little sprinkle here or there is really not going to make any difference. And also we need to bear in mind that there's no real evidence of benefit as such in dogs specifically. You know, there is wider evidence that that curcumin can have an anti-inflammatory effect. You know, but I wouldn't hang your hat on giving a turmeric supplement and that having any kind of really beneficial effect. Now, if we're talking about drugs, and I know Amanda says she doesn't like chemicals, but, you know, drugs are only kind of isolated natural compounds in many cases, certainly not all. Some are completely lab derived, but, you know, we purify things and we actually take away potentially kind of the harmful or the unnecessary things and have something that causes kind of just a single effect. Now that's, you know, obviously you may disagree with me on that, and some drugs very much don't fit that bill, but antihistamines in general, they're very safe in dogs. There's no real long-term problems that we need to think about in the vast majority of cases, and really they're fine for long-term or for intermittent use. So if it works in this case, then really it's going to be much preferable to any other drug. So, you know, some drugs do come with more side effects. Now, if we're thinking of allergic disease, often we'll be thinking of steroids, and steroids do come with a higher risk of side effects. So I've actually discussed that separately over at ourpetshealth.com. So if your dog is on steroids, or, you know, you're thinking about starting them on steroids because that is all that helps them, then definitely check that out. But, you know, antihistamines, they're generally very safe. They work well. The side effects are very few, and there's no long-term concerns. So, you know, it really depends on how much of a problem this is causing to Amanda's dog. If they've just got a bit of a runny nose, otherwise they're happy, a bit of a cough, but, you know, we can mobilize that in other ways, and that seems to just help keep things at bay. They're not getting any, you know, this dog's not getting any secondary infections because that mucus is building up, then it may be that we don't need to give any treatment or specific treatment at all. But I think to say that we, you know, can completely disregard all treatment for everything, you know, is maybe a step too far. We certainly don't want to be giving anything unnecessarily, and that's why I say if, you know, this dog is able to be managed without treatment, fantastic. But if we do need drugs at set times, or to keep things, you know, under control and avoid potentially then intermittent antibiotic treatment or long-term steroid treatment, then we should think about that strongly.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.